the video on HIV. So I forgot to mention that we have two types of HIV, which previously found HIV type 1 and the latest, not so latest, but the second HIV type was found, and usually in US and also the worldwide population. The main HIV virus is HIV 1, but in Africa and also South Asia, we have HIV 2. Basically, the HIV that we refer to usually refer to 1, and this one previously stated as rare, but recently the rate of HIV 2 is increasing. So what I want to talk about is in this video is about HAART, or highly active antiretroviral therapy. So HAART, what I want to talk about is the indications to start the medication. So one, if the mother start to have, the women start to have symptoms, and the symptoms actually can be classified into clinical stage 1, stage 2, 3, and 4. So basically 3 and 4 is more severe. And in general idea, usually it relates to the CD4 count, like what previously explained. And if the mother CD4 count is less than 350, then it is also an indication to start HAART. And also if the mother already in the 28 weeks until delivery. Okay, so basically, if the patient on HAART, then as we know, the mother to child transmission is about 25%. But with ART, it can reduce further down to only 1.2% of the MTCT. But if we use a combined or HAART, then the risk of the transmission is actually lower than that. And the problem is that the MTCT is actually relates to the pregnancy itself and also the intrapartum event, like the development of the chorioamnionitis, and then PRM, SRAM and all, and also the what we call it as instrumental deliveries, and of course the breastfeeding. So that is why we try to avoid all of this in case of the HIV. So what is the mode of delivery? So mode of delivery depends on the CD4 count. Depends on the viral load. In the latest guidelines from Mrcog, if the viral load is less than 50 copies per mil, then we can try for spontaneous vaginal delivery, avoiding the instrumental deliveries. And if the copies is 50 to 399 copies per mil, then we can actually consider planned cesarean section. But if it's more than 400 copies, then there is a strong indication for cesarean section. This one consider, and this one advice for. Okay. And then when we talk about HAART, we also talk about the intrapartum zidovudine infusion. So what is the indication? Indication for this, 1, if the viral load is more than 1,000, regardless the patients with or without rupture of membrane. Rupture of membrane. Secondly, if planned for cesarean section, we have to give the zidovudine infusions. Third, if the patient SROM or PRM or PPRM with unknown viral load, we have to give the infusion as well. Or if the patient's on monotherapy zidovudine, as if previous before the patient comes into labor, if she's only on zidovudine monotherapy, then we have to give the zidovudine infusions. So because in 2012 there is still a choice of using monotherapy zidovudine rather than use HART or ART or CART. So basically this already changed into the latest guideline in 2018, but this still can be asked in exam. So what can actually increase the HIV susceptibility? One, the STDs, which include the gonorrhea, trichomoniasis, and also chlamydia. And then the genital ulcer also can increase the risk of HIV. And male to male have a higher transmission rate, but male circumcision can significantly reduce the HIV rate. This actually one of the questions in the Mrcog part 1. So next video will be talk about the infant regime, monitoring regime.